The FDA has authorized COVID-19 booster shots for all adults. The agency gave the green light for people 18 and older to get extra doses of both Moderna and Pfizer shots. Meanwhile, a CDC advisory panel meets this afternoon. Both agencies will need to sign off in order for the shots to become available nationwide. And this comes as parts of the country are seeing an uptick in COVID-19 cases. Yesterday, CDC Director Rochelle Walensky said booster shots are working.
When we compare rates of COVID-19 disease between those who are vaccinated with 2 doses and those who have received a booster dose, the rate of disease is markedly lower for those who received their booster shot, demonstrating our boosters are working.
Dr. Bob Lahita joins us now. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita is also the author of the forthcoming book, Immunity Strong. Doctor, your introduction is getting longer and longer, but congratulations on the book. So, Doctor, tell me, now that the FDA has given its green light for booster shots for all adults, how soon could we expect to hear a response from the CDC, do you think? And does it make a difference considering, some states have actually just gone ahead and started issuing booster shots to all adults?
Yes, a lot of states, Anne-Marie, have gone ahead. And as you know, about 31 million people have already received the booster shots. These are people over the age of 18. We're certainly not recommending this for children. But the CDC Committee on Immunization Practice has to vote this afternoon. And their big concern, of course, is myocarditis or swelling of the heart muscle in young men who are below the age of 30. So that's a consideration. I don't think that's going to be something that's going to hold the booster shots back. But it is a consideration, and that committee will be debating that.
So what types of response have you been getting from your patients concerning the booster shots, Dr. Bob?
Everybody, Vlad, wants to get a booster shot. Everybody that's been vaccinated. I must answer questions on a daily basis about should I get the booster shot. People are confused because they don't realize the difference between the CDC and the FDA or other groups like the WHO. So they're getting different, people are hearing different things from different agencies. So as I said before, we should have like one spokesperson to be very, very clear about who should get what. Nevertheless, this morning, as you know, about 30 minutes ago, the FDA said, yes, it's okay to get a booster shot for everybody over the age of 18.
So the push for booster shots across the country comes as COVID-19 cases are trending upward in states like Michigan and Minnesota. Michigan had been hit so hard early on. Some health professionals expect a holiday surge in COVID cases. How are cases where you are in New Jersey?
Yeah, Anne-Marie, thanks for asking that. We are concerned about Thanksgiving and Christmas. We're concerned about an uptick. We are seeing a very, very small increase in cases. At this sitting now, I'm looking at my data, we have in New Jersey about 1,662,640 cases to date since the beginning of the pandemic. Currently, those numbers are increasing ever so slightly. We have 792 people in the hospital, 159 in the ICU, and 72 people on ventilators. So we do see a slight uptick, but I'm happy to say that it's nothing like it was in 2020 when we were all running around. We couldn't manage the numbers and kept opening different ICUs all over the place because we had to handle all of these people on ventilators. That is not the case right now. Thank goodness.
Indeed. According to the latest analysis from the CDC, Dr. Bob, this is from September 30th, 30%, which is less than half of healthcare personnel were unvaccinated. What do you make of this as your state in New Jersey approach a December 6th deadline for healthcare staff?
Well, that is very, very poor data. I see and I have said that healthcare workers, particularly nurses, doctors, and other ancillary people that work in hospitals, and indeed those 8,900 long-term care workers in nursing homes need to be vaccinated because we are in areas that are very, very volatile. We can easily be infected. We can also infect others. So the idea of mandating the vaccine for healthcare nationwide is now on the table by President Biden. And that is because any hospital system that is funded by Medicaid or Medicare from the federal government is going to be mandated to have all of their employees vaccinated. There will be religious or healthcare exemptions, of course, and that all has to be done, as you said, by December the 6th. So it's a very interesting situation. And as you know, Vlad, the other issue is police, fire, and EMS. They are the first liners who arrive at your home, and when you can't breathe and you may be infected, they're the ones who bring you to the hospital. They should also be vaccinated. It's exceedingly important that they don't bring the virus home, for example, back to their families and infect the whole crowd over the Thanksgiving holidays.
Important information there, Dr. Bob, as always. We appreciate it. Thank you very much. Have a nice weekend.
You too.